Ladies and gentlemen, welcome back to the Unfiltered Political Lens. Today we are taking a deep dive into one the federal authorities have described as the largest healthcare fraud enforcement action in the United States history, a nationwide operation that has resulted in charges against 455 defendants across dozens of jurisdictions and involved more than $6.5 billion in alleged fraudulent claims submitted to taxpayer-funded healthcare programs. The scale of the investigation has shocked many Americans because it raises serious questions about government oversight, taxpayer accountability, healthcare spending, and whether massive fraud has been hiding in plain sight for years. When most Americans think about healthcare fraud, they imagine a doctor billing for a procedure that never happened or a clinic submitting an incorrect insurance claim. What the investigators say they uncovered is something much larger, involving the alleged organized networks of providers, executives, marketers, recruiters, and middlemen operating across multiple states and allegedly exploiting Medicare, Medicaid, and other healthcare programs for enormous financial gain. Federal officials describe many of these schemes as highly sophisticated operations that use layers of companies, referral networks, financial transactions, and billing systems to conceal their activities. And according to federal authorities, the investigation stretched across 45 states and territories that involve cooperation among federal agencies, state agencies, local law enforcement organizations, and healthcare oversight offices. The Department of Justice worked alongside the Department of Health and Human Services Office of Inspector General, the FBI, state Medicaid fraud control units, and numerous additional investigative partners. The officials say the operation required years of investigative work, analysis of billing records, financial tracking, interviews, search warrants, and data analysis. One of the reasons this case was attracted to so much attention is because Medicare and Medicaid are the largest government programs in the United States. Medicare primarily serves elderly Americans and certain disabled individuals, while Medicare provides health care coverage for millions of lower-income Americans and families. Together, these programs account for hundreds of billions of dollars in taxpayer money every year, making them attracted targets to fraudsters seeking access to large pools of government funds. Federal prosecutors say many of the alleged schemes relied on simple formula: obtain access to the patients, obtain access to billing systems, maximize reimbursements, and then conceal the fraud behind paperwork that appears legitimate on the surface. Investigators allege that once a fraudulent operation learned how to exploit weaknesses in the reimbursement system, there were enormous sums of money that could flow through the operation before anyone noticed. The largest single case announced during the takedown involved a massive alleged wound care fraud operation centered in Arizona. Prosecutors claim that the defendants submitted more than $4 billion in false and fraudulent claims involving wound, allografts, and tissue products. The authorities say that the alleged scheme ultimately generated approximately $2 billion in Medicare payments. Investigators allege that products were purchased from tissue banks and then relabeled, repackaged, and billed at dramatically inflated prices. The federal officials had claimed some products were marked up by approximately 2,000% before being billed to Medicare. Prosecutors further alleged that billing levels reached extraordinary amounts that should have triggered scrutiny much earlier. And according to charging documents and public statements, the authorities believe some patients generated reimbursement claims that were exceeding hundreds of thousands of dollars, and in some cases, allegedly over $1 million. Federal officials argue these numbers were wildly disproportionate to normal Medicare treatment costs. The government contends that such billing patterns became a major red flag during data analysis. The prosecutors also alleged that illegal kickbacks played a major role in the operation, and healthcare kickbacks generally involve payments or rewards provided in exchange for patient referrals, prescriptions, treatment recommendations, or other healthcare decisions. The federal law restricts the arrangement because they can encourage the medical decisions based on the profit rather than the patient's care. The authorities also claim some participants allegedly received payments worth up to 40% of revenue generated from certain referrals. Investigators say the incentives encourage additional treatments, referrals, and billing activities. The government alleges that profit became the driving force behind many of the healthcare decisions connected to the operation. One of the most troubling aspects of the healthcare fraud is that it often affected vulnerable populations. Elderly patients are frequently targeted because the Medicare beneficiaries represent a large source of reimbursement dollars. The individual suffering from the chronic illnesses may be vulnerable because it often requires the ongoing treatment and extensive medical services. Federal officials argue that healthcare fraud is different from many other financial crimes because the patients can be harmed physically as well as financially. When medically unnecessary procedures are performed, patients may face risks without receiving corresponding benefits. Even when the procedures themselves are relatively low, risk false diagnoses and unnecessary treatments, which can create significant consequences. The authorities also highlighted allegations involving hospice fraud. Hospice care is intended for the patients facing terminal illnesses and approaching the end of their lives. The program exists to provide comfort, dignity, and support to the individuals and families during some of the most difficult moments they will ever experience. The prosecutors had also alleged that certain operators enrolled patients who did not qualify for hospice services. The investigators claimed some individuals were enrolled despite not being terminally ill, and the government further alleges that the fraudulent records were created to justify the reimbursement payments. According to public allegations, the investigators uncovered cases involving stolen identities and fraudulent enrollment practices. The authorities claim the information belonging to deceased individuals was sometimes used as part of fraudulent activity. Prosecutors argue these actions represented an extraordinary abuse of the program designed to serve vulnerable patients. Federal officials further allege that the gifts, cash payments, and electronics, alcohol, groceries, and other incentives were used to recruit the participants into some of the schemes. The investigators say these inducements encouraged individuals to remain enrolled in programs that generated the reimbursement revenue. Authorities counted that such practices violated the federal healthcare laws and regulations. Another significant case involved the Florida cardiologist Dr. Jason Finkelstein. Prosecutors had alleged that the fraudulent billing associated with the cardiovascular testing reached approximately $89 million, and federal authorities claim medically unnecessary procedures and evaluations were ordered and billed to the healthcare programs. Investigators argue that some athletes received medical clearances despite concerns that warranted additional review. The allegations gained national attention because officials highlighted a case involving a young athlete who later died from an undiagnosed heart condition. The prosecutors contend that profit-driven incentives may have compromised proper medical oversight, and the federal officials also announced multiple mental health fraud investigations. Prosecutors allege that some of the defendants billed Medicaid and other healthcare programs for services that never occurred. Investigators claim that the certain organizations that reported counseling, crisis intervention, and treatment services that were allegedly never delivered. And according to the authorities, also some operations allegedly targeted vulnerable individuals, including homeless populations. They argued that vulnerable groups were less likely to challenge inaccurate records to recognize fraudulent billing activity. Prosecutors claimed that this created opportunities for the abuse. And the national enforcement action also included allegations involving the opioid related healthcare fraud. Federal officials say certain defendants allegedly exploited the addiction treatment system for financial gain. And the investigators argue that these schemes undermined the efforts to address the actual nation's ongoing opioid crisis. Rather, transportation fraud represented another category of changes that were announced during the operation. Medicaid often reimburses the transportation services for the eligible patients who require assistance traveling to medical appointments. Prosecutors allege that some companies billed for tips that never occurred or inflated the transportation cost beyond legitimate levels. The authorities say transportation fraud may appear small when they view it on a single claim basis. However, the investigators note that thousands of alleged false claims can quickly add up to millions of dollars. The federal officials argue that the repeated small frauds often become major criminal enterprises in the end. And one of the questions many Americans are asking is how the fraud on the scale could allegedly continue for so long. The critics argue that existing oversight systems should have detected the unusual billing patterns much earlier. Supporters of reform say this case demonstrates weaknesses in both government oversight as well as private contractor review systems. The federal investigators say advanced analytics played a major role in identifying the suspicious activity. Rather it be relying solely on traditional audits, authorities increasingly use machine learning tools, building pattern analysis, artificial intelligence systems, and financial intelligence methods. Investigators say these technologies also helped identify networks that may have otherwise remained hidden. Officials report that data analysis allowed investigators to compare providers against regional and national norms. When certain providers submitted claims vastly exceeding expected levels, those providers became subjects of further review. And authorities say technology dramatically improved their abilities to identify the anomalies. The Department of Justice healthcare fraud is not a victimless crime. Every fraudulent payment comes from taxpayer-funded programs that are also financed by workers, businesses, and taxpayers across the country. Federal officials contend that billions of lost fraud ultimately increase the pressure on healthcare budgets as well as taxpayers alike. Healthcare fraud can also distort the medical decisions that are being made when financial incentives become more important than the patient's outcome. Trust in the healthcare system begins to erode. Many experts argue that the public's confidence is difficult to restore once that trust is damaged. Authorities have reported a substantial asset seizure connected to the investigation as well. Federal officials say they have seized or removed a series of luxury vehicles, bank accounts, cryptocurrency holdings, jewelry, cash, and real estate assets. Investigators believe many of these assets were purchased using proceeds from alleged fraud schemes. The asset forfeiture serves two purposes, according to the prosecutors. First, it deprives the defendants of financial gains allegedly obtained through criminal conduct. Secondly, it provides an opportunity for the government to recover taxpayer funds. And the investigation has also sparked debate regarding the healthcare spending in the United States. While some of the critics argue that excessive complexity within government healthcare programs creates the opportunities for fraud, others contend that stronger oversight mechanisms could significantly reduce losses without reducing patient services. And another issue raised by the investigation involves the growing role of organized criminal networks in healthcare fraud. Although authorities increasingly describe healthcare fraud as a form of organized financial crime rather than isolated misconduct, the investigators say sophisticated actors may view healthcare programs as much more of a lucrative targets. The government has also emphasized that all defendants remain presumed innocent unless proven guilty in a court. The charges represent allegations that must ultimately be tested through the judicial process. The evidence will be examined, defenses will be presented, and the courts will determine the outcome of each case. At the same time, the size of the enforcement action was generated by partisan concerns, and Americans across the political spectrum generally agree that taxpayer dollars should be spent on patient care rather than fraudulent schemes. The challenge lies in designing systems that detect fraud without creating unnecessary barriers for legitimate providers. The many policy experts, they will argue prevention is more effective than recovery. Once the billions of dollars have been paid out, recovering those funds becomes difficult and expensive. Preventing the fraudulent claims before payments may produce significant better results. A comprehensive reform strategy would likely require multiple layers of oversight, advanced AI driven monitoring systems that could flag unusual billing activity in real time rather than years later. High risk claims could undergo additional review for when the payments are released. Provider verification standards could also be strengthened, and organizations receiving large reimbursements could face periodic audits and credential reviews. Referral relationships or ownership structures could receive greater scrutiny or identity conflicts of interest. Transparency measures could provide another layer of protection as well. People reporting of large reimbursement patterns may allow researchers, journalists, watchdog groups, and regulators to identify unusual activity more quickly. Increased transparency often creates the additional accountability. Federal and state agencies could also improve the information sharing as well. Fraudsters often exploit the gaps between our agencies and jurisdictions, and better coordination could help investigators identify the suspicious patterns that cross state lines. Whistleblower protections may play a critical role as well. The employment frequently and misconduct before regulators do.